I want to talk to you today about a kind of dizziness that frightens a great many older adults, that sends people to the doctor convinced something is terribly wrong. And that is, in fact, one of the most common and one of the most genuinely fixable causes of dizziness there is, often with a simple maneuver that most people have never heard of. I'm talking about the dizziness that hits you when you move your head a certain way. When you roll over in bed, when you tip your head back to look up at a high shelf, when you bend down to pick something up, or when you lie down or sit up. Suddenly the room spins violently, a brief but intense whirling sensation that can leave you clutching the bed or the wall, feeling sick and afraid to move your head again. Doctors call this benign paroxysmal positional vertigo, often shortened to BPPV, and despite how alarming it feels, the word benign in its name is genuinely accurate. It is not dangerous. It is extremely common in older adults, and, most wonderfully, it can often be fixed quickly with a simple repositioning maneuver that most people, and even some who suffer from it for months, simply don't know about. So today I want to explain what's actually happening in your ear, why it causes that spinning, why it's so common as we age, the simple fix, and when dizziness warrants seeing a doctor. Because this is one of those rare cases where a common, frightening problem has a genuinely simple, often dramatic solution. Let me start with what's actually happening in your ear, because understanding it makes this whole thing far less frightening and explains why the fix works. Deep inside your ear, beyond the part that hears, is your vestibular system, your balance organ, a remarkable set of fluid-filled canals and chambers that sense the position and movement of your head. Part of this system contains tiny crystals, sometimes called ear rocks or canaliths, which sit in a particular spot where they help you sense gravity and the position of your head. Normally, these crystals stay where they belong, but sometimes, especially as we age, some of these tiny crystals come loose and drift out of their proper place into one of the fluid-filled balance canals where they don't belong. And here's what causes the vertigo. When you move your head in certain ways, these displaced crystals tumble through the canal, dragging the fluid with them and sending a false, powerful signal to your brain that you're spinning when you're not. Your brain receives this sudden false message of intense motion, and the result is that violent, brief, whirling sensation. So the spinning isn't coming from your brain or from anything dangerous. It's coming from tiny crystals that have drifted into the wrong part of your ear and are sending false motion signals when you move your head. Once you understand that, two things become clear: why it's triggered specifically by head movements and positions, and why the fix involves moving your head in a particular way to guide those crystals back where they belong. So let me describe the characteristic pattern of BPPV, because recognizing it is what points toward this simple, fixable cause, rather than something more worrying. The hallmark is that the dizziness is triggered by changes in head position. People most often notice it when rolling over in bed, when lying down or sitting up from lying, when tipping the head back to look up, or when bending forward and down. The vertigo is typically intense but brief, lasting usually less than a minute, often just seconds once the head is still, though it can leave a lingering unsteadiness or nausea afterward. It's a true spinning sensation, the room or you seeming to whirl, rather than just lightheadedness. It comes in episodes, triggered by movement, with calm in between when you keep your head still. And it doesn't come with hearing loss, ringing in the ears, or neurological symptoms like weakness or slurred speech. So the pattern, brief, intense spinning, triggered specifically by head movements and positions, especially rolling over in bed or tipping the head, with no hearing or neurological symptoms, is the signature of BPPV. That pattern is genuinely good news, because it points to this common, benign, and very treatable cause. If your dizziness fits that pattern, there's a real chance it can be fixed simply. Let me explain why this becomes so common as we age, because that's why it matters so much for older adults. Those tiny crystals are more likely to come loose and drift out of place as we get older, so BPPV becomes increasingly common with age, and it's one of the most frequent causes of dizziness and vertigo in older adults. It can also be triggered by a blow to the head, by other ear conditions, or by long periods lying down, but often it just happens on its own with age. So this is genuinely a common older age problem and a frequent reason older adults experience dizziness, which is exactly why it's so worth knowing about. And here's why the awareness matters beyond just understanding. The dizziness of BPPV, that sudden violent spin when you move your head, is itself a real cause of falls in older adults because it can strike when you're getting up, bending, or turning and pitch you off balance. So BPPV isn't just frightening and unpleasant, it's a genuine fall risk. But because it's so treatable, addressing it removes both the misery and the fall risk, which makes the simple fix all the more valuable. So let me tell you about that simple fix, because this is the heart of what I want you to know. The thing most people don't realize exists. Because BPPV is caused by crystals that have drifted into the wrong part of the ear, it can often be cured by a series of specific head and body movements that guide those crystals back out of the canal and into the place where they belong, where they no longer cause trouble. These are called repositioning maneuvers, and the best known is often called the Epley maneuver. It involves a particular sequence of moving the head and body through several positions, each held for a short time, in a specific order, which uses gravity to roll the displaced crystals back to their proper home. And the results can be genuinely dramatic. For many people, one or a few of these maneuvers resolves the vertigo, sometimes completely, sometimes in a single session. Imagine that. Someone who has been suffering frightening, life-disrupting spinning for weeks or months, afraid to roll over or bend down, who can be substantially or completely relieved by a simple, drug-free, few-minute repositioning of the head. That's why this knowledge is so valuable, and why it's such a shame that so many people suffer with BPPV without knowing this fix exists. Now let me be very clear and responsible about how to approach this fix, because this is important. The right first step is to see your doctor, who can confirm that your dizziness is indeed BPPV, often with a simple positional test in the office where they move your head and observe your response, and, crucially, can make sure it isn't something else that needs different attention. Once BPPV is confirmed, the doctor, or a physical therapist, an audiologist, or another trained professional, can perform the repositioning maneuver for you, properly and safely, and this is the ideal way to have it done, especially the first time. I want to gently caution against simply trying to do these maneuvers yourself from a video without first being properly diagnosed, for a couple of reasons. First, it's important to be sure your dizziness really is BPPV and not something else. And second, the maneuvers need to be done correctly to work, and done wrong, they may not help or may be uncomfortable, and for some people with certain neck or back conditions, they need to be modified. That said, once a professional has diagnosed your BPPV and shown you the maneuver, they may teach you a version you can safely do at home if it recurs, which is genuinely helpful since BPPV can come back. So the responsible path is, see your doctor to confirm it's BPPV, have the repositioning maneuver done by a trained professional, and learn from them whether and how you can safely do it at home for recurrences. Done this way, the simple fix is both safe and often wonderfully effective. Let me address the recurrence point honestly, because it's part of the real picture. BPPV can come back, sometimes weeks, months, or years later, because the crystals can drift loose again. This isn't a sign that anything is wrong or that the treatment failed. It's just the nature of the condition. The good news is that when it recurs, the same repositioning maneuver usually works again, which is exactly why having a professional teach you a safe home version, once you've been properly diagnosed, can be so valuable so you can address recurrences yourself. So if your BPPV comes back, don't despair. It's treatable again the same way. Knowing this takes away a lot of the fear, because you understand both that it's benign and that, even if it returns, there's a reliable fix. Now let me be clear and careful about when dizziness warrants seeing a doctor and when it might be something other than BPPV, because while BPPV is common and benign, dizziness has other causes, some of which need different attention, and I want you to be safe. Always have new or significant dizziness evaluated by your doctor, both to confirm BPPV and to rule out other causes. And there are particular warning signs that suggest the dizziness may be something other than benign BPPV and warrant prompt or urgent medical attention. Seek urgent care if dizziness comes with any of these: a sudden severe headache, weakness, numbness, or tingling, especially on one side of the body, difficulty speaking or slurred speech, difficulty walking or severe loss of balance and coordination, double vision or vision loss, confusion, chest pain, or fainting, because these can signal a stroke or another serious problem rather than BPPV. Also see your doctor, though less urgently, if your dizziness comes with new hearing loss or ringing in the ears, which points to other ear conditions, if it's constant rather than triggered by position and brief, if it's accompanied by significant ongoing nausea and vomiting, or if it doesn't fit the BPPV pattern. So the framework is the brief, position-triggered spinning dizziness without hearing or neurological symptoms is likely BPPV and very treatable, but get it confirmed by your doctor and treat as urgent any dizziness with the stroke-type warning signs I listed, or see your doctor for dizziness that comes with hearing changes, is constant, or doesn't fit the pattern. This way you get the benefit of the simple fix for BPPV while staying safe about the less common serious causes. Let me paint you a picture of how this so often plays out, because it captures both the misery and the relief. Picture a woman in her 70s who wakes one morning, rolls over in bed, and is suddenly hit by a violent spinning sensation that leaves her gripping the mattress, nauseated and terrified, certain she's having a stroke or that something is gravely wrong. Over the following days, she finds that rolling over, lying down, sitting up, or tipping her head back to reach a shelf all trigger the same brief, awful spin, so she becomes afraid to move her head, sleeps propped up, moves gingerly, and grows anxious and limited, her life shrinking around her fear of triggering the dizziness. She assumes she'll just have to live with it, or fears it's some serious brain or heart problem. Then she sees her doctor, who recognizes the classic pattern, confirms with a simple positional test that it's BPPV, reassures her that it's benign and common, and performs the repositioning maneuver right there in the office. And remarkably, after the maneuver, the vertigo is largely gone. She can roll over and tip her head without the spinning. What had terrified and limited her for days turned out to be displaced ear crystals, fixed in minutes by a simple maneuver she'd never heard of. The relief and the lifting of her fear is enormous. That story happens all the time, and the only thing standing between the suffering and the swift relief is knowing that this common, frightening dizziness is often so simply fixable. And let me speak directly to those of you caring for or close to an older person, because this is common, frightening, a fall risk, and wonderfully treatable, so your awareness can genuinely help. If a loved one describes sudden spinning dizziness triggered by rolling over in bed, lying down, sitting up, bending, or tipping the head back, brief and intense, without hearing loss or neurological symptoms, recognize that this sounds like BPPV, a common, benign, and very treatable condition, and encourage them to see their doctor to have it confirmed and treated with the repositioning maneuver, reassuring them that it's usually not dangerous and often quickly fixable. This can lift enormous fear, since people often assume such dizziness means a stroke or brain problem. You can help by ensuring they get to the doctor or a physical therapist who can perform the maneuver. Meanwhile, because the dizziness is a fall risk, help keep them safe. Encourage them to move their head slowly and carefully, to have support nearby when getting up or bending, and to keep their environment safe from falls. And do take seriously, with urgency, any dizziness accompanied by the stroke-type warning signs, sudden severe headache, one-sided weakness or numbness, slurred speech, difficulty walking, vision changes, or confusion. Helping a loved one recognize that their terrifying positional dizziness is likely benign and simply treatable, and getting them to the right care can relieve both real misery and a genuine fall risk, often remarkably quickly. Let me draw this all together. That frightening dizziness that hits when you move your head, rolling over in bed, lying down or sitting up, tipping your head back or bending down, a brief, intense spinning sensation, is very often benign paroxysmal positional vertigo, BPPV, one of the most common causes of dizziness in older adults. It's caused by tiny crystals in your balance organ coming loose and drifting into the wrong part of the ear, where they send false motion signals when you move your head, producing the spin, and it becomes more common with age. Despite how alarming it feels, it's genuinely benign and not dangerous, and, most wonderfully, it can often be fixed quickly with a simple repositioning maneuver, like the Epley maneuver, that guides the crystals back where they belong, sometimes resolving the vertigo in a single session. The responsible path is to see your doctor to confirm it's BPPV and have the maneuver done by a trained professional who may teach you a safe home version for recurrences, since BPPV can come back and is treatable again the same way. And while BPPV is benign, always have dizziness evaluated and treat as urgent any dizziness with stroke-type warning signs like sudden severe headache, one-sided weakness, slurred speech, difficulty walking, vision changes, or confusion. So here's what I'll leave you with. First, understand that sudden, brief, intense spinning, triggered specifically by head movements, rolling over in bed, lying down, sitting up, tipping your head back, or bending, without hearing loss or neurological symptoms, is very often BPPV, a common benign condition caused by displaced crystals in the ear, not a sign of anything dangerous. Second, know that it's often wonderfully treatable with a simple repositioning maneuver that most people have never heard of, which can resolve the vertigo quickly, sometimes in a single session. Third, see your doctor to have your dizziness confirmed as BPPV and treated with the maneuver by a trained professional, a doctor, physical therapist, or audiologist, rather than just trying it yourself from a video before being diagnosed, and ask them whether you can safely do a home version if it recurs, since BPPV can come back and is treatable again. Fourth, while you have symptoms, protect yourself from falls by moving your head carefully and having support when getting up or bending. And fifth, always have dizziness evaluated and seek urgent care for any dizziness with stroke-type warning signs, sudden severe headache, one-sided weakness or numbness, slurred speech, difficulty walking, vision changes, or confusion. That terrifying spinning when you move your head is, far more often than people realize, a benign and simply fixable problem. So don't suffer it in fear and silence. Take care of yourself, get it checked, and know that relief is often just a simple maneuver away. And because confirming BPPV and safely performing the maneuver, as well as ruling out other causes, require a professional, please treat positional dizziness as your reason to see your own doctor, rather than as a substitute for that care, and seek urgent help for the warning signs.